And the last but not the least in this session, Dr. or Prof. Masayuki Ohta. He's going to tell us about predictive scoring system of type 2 diabetes after sleeve gastrectomy. It's a comparison between ABCD and DiaRem scores. Welcome, Dr. Masayuki.
Oh, thank you for your kind introduction. I'm honored to have an opportunity to present my paper in this Congress. In Japan, laparoscopic sleeve gastrectomy has been covered by the government health insurance since 2014. But obese patients with no remission of type 2 diabetes after sleeve gastrectomy have been experienced. Recently, ABCD and DiaRem scores have been developed to predict type 2 DM remission after gastric bypass, but there have been no reports of comparison between the scoring systems after sleeve gastrectomy until now. Literatures reported predictors of diabetes remission after gastric bypass and sleeve gastrectomy. Most of them demonstrated the glycemic response is well related to type of operation, age, BMI, C-peptide, DM duration, and insulin use. As you know, ABCD scoring system was developed by Professor Wei-Ji Lee from Taiwan and consists age, BMI, C-peptide, and duration of type 2 DM. This scoring system is positively correlated with DM remission. Professor Wei-Ji Lee has already used this scoring system in patients with sleeve gastrectomy and demonstrated the ABCD score can predict the success of type 2 DM treatment by sleeve gastrectomy. In Japan, we also used ABCD scoring system and performed a multi-center study, retrospective multi-center study, to choose procedures, sleeve gastrectomy or sleeve with duodenal jejunal bypass, sleeve DJB, in obese patient with diabetes. As a result, sleeve DJB was superior to sleeve gastrectomy in diabetes patient with ABCD score less than 6 or insulin use. Therefore, patient with severe diabetes ABCD score less than 6 prefer sleeve DJB, and patient with mild diabetes ABCD score 6 or more do not need bypass surgery. It's one of the topics in Japan now. On the other hand, DiaRem scoring system was developed in USA and consists age, insulin use, hemoglobin A1C, type of antibiotic medication. This scoring system is negatively correlated with type 2 DM remission. More recently, individualized metabolic surgery score was developed in USA as more than 5-year long-term predictor to indicate procedure choice, sleeve gastrectomy or Roux-en-Y gastric bypass. This scoring system consists number of diabetes medications, insulin use, duration of diabetes, and preoperative hemoglobin A1C. And it's also negatively correlated with type 2 DM remission. This scoring system divided the patient into 3 groups, mild, moderate, and severe, and suggested Roux-en-Y gastric bypass in mild diabetes patients and sleeve gastrectomy in the severe patients, and recommended Roux-en-Y gastric bypass in the moderate patients. We preliminarily compared ABCD scoring system with IMS scoring system in very small number of our patients followed for more than 5 years, treated by sleeve gastrectomy. IMS scoring system classifies most of the patients into moderate, and patients with ABCD score 6 or more had long-term 5-year remission of diabetes. Therefore, IMS scoring system may recommend Roux-en-Y gastric bypass in patients with 6 or more ABCD score who will certainly have diabetes remission only by sleeve gastrectomy in Japanese obese patients with diabetes. Now, I think IMS scoring system may not be suitable for Japanese obese patients with diabetes. Anyway, comparison between DiaRem score and ABCD score after gastric bypass has been already reported, and the results were controversial. However, there have been no reports of comparison between ABCD and DiaRem scores after sleeve gastrectomy until now. The aim of this study was to investigate which is a better predictor of type 2 DM remission after sleeve gastrectomy for Japanese obese patients. This study enrolled 44 Japanese obese patients with type 2 diabetes who underwent laparoscopic sleeve gastrectomy in our institute and were followed for more than 1 year. Mean age was 43 and mean weight and BMI were 117 kg and 44, respectively. Preoperative hemoglobin A1C was 7.9%, C-peptide 3.9, and DM duration was 4.8 years. 36 of the 44 patients received DM treatment, including oral medication and insulin. Sleeve gastrectomy was carried out using endoscopic linear staplers from the greater curvature antum, 5 cm proximal to the pylotic ring to the angle of His alongside a 32 French endoscope instead of Buzy, and added to Overson reinforcement. Mean ABCD and DiaRem scores were 6.2 and 6.1, respectively. Complete remission of type 2 DM was defined by less than 6.0% hemoglobin A1C without medication, and partial remission by less than 6.5% hemoglobin A1C without medication. DiaRem score spans from 0 to 22 and was divided into 5 groups. When DiaRem score was compared with ABCD score using area under the curves from the ROC curves, DiaRem score was converted into data of subtracting from 22. Statistical analysis were performed using Spearman's correlation coefficient, receiver operating characteristic ROC curve, and DeLong test. In the result, we never experienced open conversion and serious complication in this series. Weight loss and percent excess weight loss after 1 year were 36 kg and 72%, respectively. Hemoglobin A1C after 1 year was 5.7%. Complete remission was achieved in 37 of the 44 patients, 84%, and partial remission was achieved in 41 patients, 93%. The both scoring systems were significantly well correlated with type 2 DM remissions. when DiaRem scoring system was compared with ABCD scoring systems, the two scoring systems were significantly statistically well correlated. Area under the curves from the ROC curves were compared between the two scoring systems. ABCD scoring system tended to have superiority in CR complete remission, and DiaRem scoring system tended to have superiority in CR plus PR, but there were no statistically significant differences in CR and CR plus PR between the two scoring systems. In discussion, regarding C-peptide, it's an indicator of the biosynthesis of insulin. However, serum level is often influenced by diet and insulin administration. The fasting level is usually used in ABCD scoring system in Japan, but it needs special concern due to lack in the regular blood examination set.
1 minute, please.
This study has some limitation, including retrospective study, small number of patients, and high remission rate of type 2 DM. Regarding high remission rate, another multicenter study from Japan demonstrated very high remission rate 3 years after sleeve gastrectomy. So our remission rate is not so extremely high. In conclusion, the both scoring system may be useful tool for prediction of type 2 DM remission after sleeve gastrectomy. Thank you for your attention.
Thanks. Questions, please. Okay, I think we're going to end this session and we'll go for a lunch break, and we'll resume after half an hour to 40